Mr. Chairman, could the gentlelady please specify her amendment?
Yes, I have an amendment specified H 2483 AMD underscore 01 underscore XML.
And if I could reserve a point of order, Mr. Chairman.
Board order is observed by the gentleman from Virginia. Clerk will report.
Amendment to the amendment in the nature of a substitute to H.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Texas is recognized for 5 minutes in support of the amendment.
Well, thank you, Mr. Chairman. I have this important amendment on an issue that's squarely before this committee today, and that will be again and again. But before I get into that amendment, I do want to associate myself with the comments from Ranking Member Pallone and Oversight Ranking Member Clark, because we cannot remove the work that this committee is doing from the context that we are doing it in, which is what my colleagues on the other side of the aisle keep suggesting we do today. This isn't bickering, as Mr. Obernolte suggested. It is objecting. It is objecting to using this committee and this Congress in a charade that obscures what the Trump administration is doing, what it is actually doing. Cutting the programs that we're authorizing and cutting the funding that we're appropriating to make them possible. And on this bill, for example, we just heard from Representative Castor. We know that the White House Office of Management and Budget has shared its budget proposal eliminating the Support Act programs that we are here talking about reauthorizing. And so, you know, it's really important that we understand the bigger context in which this is happening. And these cuts are continuing, and that's what my amendment is about. My amendment is about cuts to Medicaid, and more than 70 million people in every state in this country rely on Medicaid to receive the health care they need, including mental health care. In my home state of Texas, Medicaid provides health care to more than 3.8 million people, and Texas has very narrow eligibility for Medicaid coverage. Adults under 65 who are not disabled or raising a child are ineligible for Medicaid, no matter how much they make, no matter how low their income is. And those that do qualify, the formula is based on the federal poverty level, as we all know. And as a reminder, what is the federal poverty level? This year, for a single person, it is income of $15,650 a year. For a family of four, it's $32,150. So many people in Texas don't even qualify for Medicaid. But for the people who do, it is children, adults with disabilities, people living in nursing homes, and moms who've just given birth. And I should add, as we look ahead to the proposals we anticipate coming to this committee, 57% of the adults in Texas, of those adults I just identified, who receive Medicaid are working. Despite Texas's narrow limits, in my district, more than 85,000 of my constituents rely on Medicaid, and more than 60,000 of them are children. And I've looked at the most recent tables. I'm sorry that many of my Republican colleagues from Texas are not in here to hear this, but most of my Republican colleagues on this committee from Texas have more constituents relying on Medicaid in their districts than I do. And of course, Mr. Chairman, I looked at Kentucky's 2nd District, and as I'm sure you know, there are more than 211,000 people in that district relying on Medicaid. This matters. This matters to the people who are relying on Medicaid for their critical health care, including their mental health care. It matters to the people that we are here to represent. They are relying on Medicaid for access to treatments, for access to the devices and the care that we spend so much time on this committee working on, trying to enable, trying to make possible. And there is just no way that you can cut billions of dollars from Medicaid without hurting all of our constituents. And you don't have to just take my word for it. The CBO said so on March 5th. I have the letter from the CBO here responding to a request from Ranking Member Pallone and Mr. Boyle. I would like to submit it for the record. This says that you cannot cut from the budget from our committee without cutting Medicaid. I'd like to submit that for the record, Mr. Chairman.
So ordered.
Thank you. It's just, there is not a single congressional district that's going to come out unscathed from cuts to Medicaid. Our constituents depend on us to stand up for them in this room and in this body. So I have an amendment at the desk in this markup to ensure that we do that by preventing the Department of Health and Human Services from taking actions that would reduce eligibility, reduce enrollment, reduce covered benefits, increase cost sharing, or reduce federal funding for medical assistance for people eligible for Medicaid or CHIP. Simply put, it prohibits the administration from making cuts to the Medicaid program. And I hope that my colleagues on both sides of the aisle understand the damage this is going to do to all of our constituents, to people across this country, and to the work that we have been doing on this committee to help people get access to the health care, the treatments that they need, including mental health care. So I hope that everyone on this committee can come together to protect the people we represent. And with that, I'll
Would that gentlewoman yield to me? Would the gentleman?
yes.
You mentioned, the gentlewoman mentioned the OMB budget that proposes to cut 8 of the Support Act programs, and I'd like to submit that for the record, Mr. Chairman, if I could.
The budget? Without objections to order.
Thank you. I yield back to the gentlewoman.
Thank you, and I yield back, Mr. Chairman.
Gentlelady yields back. The gentleman